Hello, my name is Jamal Alford, and I'll be talking about the role of policy and law in healthcare. Law have the power and duty to ensure conditions for people to be healthy and limit the state's power to constrain autonomy, privacy, liberty, and propriety interests of individuals and businesses. These policies and laws, although not perfect, dictate every aspect of how this country deals with its healthcare system. From the formation and management of healthcare and how it is regulated, the payment and compensation of services, or implementing systems to maintain safety, today's health policies and laws are constantly being created and improved to tackle these issues. Over the last century, healthcare has improved dramatically to increase longevity and quality of life. The development of vaccines and their widespread eradicated many communicable diseases and caused the reduction of serious chronic diseases. The rise of healthcare technology and the increase in better healthcare services has pushed the improvement of healthcare, but moral and ethical issues prove there is more to be done that can improve healthcare even further. Currently, the role of health policy and law is to help increase healthcare access, lower costs, and improve delivery methods, while improving privacy and confidentiality. These policies and laws establish guidelines that benefit patients' healthcare organizations and other our healthcare systems through protocols that can help prevent human error and poor communications around medical decisions. Health policy and law can be seen as a way of promoting wellness for all Americans and making sure that health goals are met to ensure that even the most vulnerable of our citizens can access health care. An example of the role of health policy in law today can be seen through the Affordable Care Act. Implemented in March 2010 under the former President Barack Obama, millions of Americans gained health coverage despite pre-existing conditions to reduce health disparities. Other mandates that were created through the ACA also directly influenced public health through the creation of the Prevention and Public Health Fund, the nation's first mandatory funding for public health, and the first National Prevention Strategy, a sweeping development program that for the first time focuses on individual behavioral choices and the social detriments of health. The problem of health policy and law and the political agenda that can negatively affect the health of continuing the health disparities in our healthcare system. Politics is having an outsized influence on health currently. The political climate is affecting many Americans, and the current rise and empowerment of political views that lessen good health outcomes to other cultural, philosophical, and societal views, such as profit making and satisfying populist impulses, are some of the reasons. For instance, efforts are still ongoing to strip down or remove the Affordable Care Act, which would deprive many people of the ability to have affordable insurance and impact millions who have pre-existing conditions. Problems of health policy and law are defining solutions to eradicate health inequalities and disparities that still plague citizens of this country. Dealing with social and economic problems that keep people from receiving adequate health care is a problem that can be changed over time if more policies and laws were put into place. The ACA is a step in the right direction to accomplish these, but more can be done. Policies and laws that will continue to further expand Medicaid and Medicare for the uninsured and uninsured, underinsured and uninsured, increase health equity, and find solutions to give underprivileged people solutions to access and obtain more health services. Policymaking is needed to provide clear guidelines on how to address the health problem that affects our society and produce clear guidelines with solutions to deal with these issues. The Health Insurance Portability and Accountability Act privacy rule is an example of a policy that gives guidelines that protects patients' information from being released to the public, but also allows the exchange of this information only if needed between medical professional situations. These policies are needed to cover numerous situations, including protocols for treatment procedures, outlines on how healthcare professionals should respond to specific medical situations, guidelines for running an effective facility as staff must be able to care for patients safely while maintaining their well-being, and handling and administering of pharmaceuticals no matter if the medication is over-the-counter, controlled, or non-controlled. Policymaking can also include protocols for recording, handling, and delivering medication, maintaining physical security, data privacy, and technology procedures that are extremely important in any healthcare organization. The role of policy and law in healthcare can be used to take actions that can be used to achieve public health goals in our society to promote healthier, more safer lives in both our communities and in the workplace, and promote health and positive health behaviors that increase longevity and quality of life. Despite the problems of health policy and law being bogged down in political agendas and the search for solutions to deal with social and economic problems that keep people from receiving adequate health care, policies and law are needed to cover numerous situations, including protocols for treatment procedures, how healthcare professionals should respond to specific medical situations, guidelines that address health problems that affect our society, and solutions to deal with these issues.